All right. So, good afternoon. I'm so glad that everyone could join us. My name's Tanya Harris, and I manage the engagement team here at Health Consumers Council, and I'm here with my colleague Tanya B, who looks after Wellco. So, we're really happy that you could be here today to hear from Leila Mohmedi from the Better Health Coaching Service. And I'd just like to start before we start the presentation by acknowledging that where I am today is the lands of the Whadjuk Noongar people, and I want to pay my respects to elders past and present. I'd also like to pay my respects to any other Aboriginal people who might be, Aboriginal and Torres Strait Islander people who might be on the call today, and acknowledge that Australia always was and always will be Aboriginal land. So, yeah, so we're thrilled to have Leila today, and I'm going to hand over to you straight away, Leila, for your presentation.
Thanks so much, and thank you, Tanya, for the warm introduction. And thanks everyone for joining today. It's lovely, it's Monday, it's actually a Monday afternoon here where I am, but I hope this is an engaging presentation. Like Tanya had mentioned, my name is Leila. I'm a community engagement officer. I work at the Better Health Company. You might have heard of us before, but if not, hello. So today I'll go through actually the Better Health Coaching Service, which is actually our new initiative that we're lucky enough to have funding for by the Department of Health. And it's essentially our adult service in WA. So I'll introduce you to the service, a little bit about us as well. There's always question time at the end. So if you did have any questions, feel free to also join in during the session, but there'll be a designated time at the end as well for you to ask away. So what I might do is also start with a little bit of an acknowledgement. So as I mentioned, I'm actually not based in WA, I'm based in Melbourne. So I'd like to show my respects and acknowledge the traditional custodians of the land that we're all here today, of elders past, present, and emerging. So I'm actually in country down in Naarm, so Melbourne, as some might know. So this is Wurundjeri country, and it's the land of the people from the Kulin Nation. I grew up here in Melbourne, Wurundjeri country, and I'm really glad that with technology we're able to sort of meet across different lands and the ability to share some information with you virtually, which is great. So what I like to do is potentially start a little bit about who we are. So who's Better Health Company? You might be aware of us, you might not, but essentially we're a health promotion organisation. And we really aim to develop and deliver evidence-based healthy lifestyle services across the state, so nationally as well. So I guess overall aim is to reduce the risks of chronic disease across Australia among a range of populations. We're quite lucky, so we do have services delivered both in person and online for a whole range of different individuals and local communities. Our services are all designed by health professionals. I'm quite lucky I actually get to work alongside a lot of our allied health teams. So we have dietitians, nutritionists, exercise physiologists, health psychs as well. The whole range of really professional individuals. My background is actually in public health, so I do a lot of sort of the community awareness and the health communication as well. All our services currently in WA are funded by the Department of Health. And I guess a subsection of our company too is we have the Better Health Hub, and that's an additional component of the company that provides things like training courses. We provide products, resources, fact sheets as well, and we really do pride ourselves on health communication. So all these services and different resources are designed to be understood by all and for audiences, you know, such as ourselves, such as health professionals or professionals within the public health space, but also for everyday individuals too. So the parents and the kids and everyone within our community. In terms of our services, are actually designed by health professionals and always based on the best available evidence that we have currently. So that means aligning to all relevant national nutrition and physical activity recommendations, but also taking on feedback by the individuals that take part in our service, because you know their lived experience is important. And using, I guess, that feedback to really inform our services so they meet the needs of people that we're actually working with. So a bit of current offerings for WA. If you potentially have heard of us before, you might know of the Better Health program and of the Active 8 program. So they've actually been long-standing programs we've had in the community. Better Health program we've actually had since 2014 and Active 8, I believe, 2017. and that's been in Western Australia for a while now. Better Health program is our primary aged program, so for 6 to 12-year-olds. And then Activate is a program for parents and carers within their early years, so 2 to 5. And we now are quite lucky to bring a service for adults, so for 18 plus. Better Health coaching really is all done over the phone, so that's a telephone-based service, all done online for WA adult. Whereas for our Better Health program and for Activate, we do have programs both within the community. So we do run some group-based programs at bounce trampoline parks, which families love, the Better Health program. And in terms of Activate, we actually partner with a lot of child parent centres to deliver the programs within the community for families. Currently, those programs are in our metro locations, but we also can provide those services within the regions as well. I won't sort of talk too much about the family programs purely because the session today will focus mostly on the adult service. But if you did want to know more about the family programs, I definitely can do more presentations in the future and give more information going via email or over the phone too. But essentially those ones run online, face-to-face, and they run for about 8 to 10 weeks. Similarly, they kind of covered similar topics. So really centre around our key pillars, which are nutrition, physical activity and behaviour change. All right, so a bit about Better Health coaching service and what really is the service itself. So like I mentioned, it's all done over the phone and it's for adults in WA. Currently funded by the Department of Health, so it's free for eligible adults that do decide to join. And really, I guess the key aim of the service itself is really to engage Australian adults in WA who might be seeking support for a multitude of sort of health reasons, but really to improve their healthy lifestyle choices. And I guess the bigger picture overall aim is really to reduce the risk of chronic disease within the community. So we actually began service delivery back in October of 2024, so just of last year. And I believe we're currently funded to service the program up until 2019, I believe. Really, we're accepting registrations and referrals today, so there's no wait list, there's immediate start. So if this is something that potentially might be useful for the communities you work with, we really would appreciate any sort of referrals or registrations. But yeah, definitely something that we're quite excited about, that we don't have to have wait lists for people that really are seeking support. Before we do really talk to, I guess, the service itself and the components that are involved, I do want to just touch upon the health coaching approach. And if you have been to any of my presentations in the past, I love to say that health coaching, I think, gets such a negative rap and a bit of a negative connotation within providing support. It can be a bit of a fluffy term. So I always like to sort of really reiterate the evidence base and support, because I really do believe health coaching is quite a, I guess, beneficial approach to supporting individuals. So I guess in terms of what health coaching means for Better Health Company and for us, our coaches are all dual qualified. So, in addition to having their tertiary qualifications, they're all allied health professionals. Like I mentioned, range of backgrounds. So we have dietitians, we have exercise physiologists, we have health psychologists as well. But in addition to that, they also have to have a certificate in our health coaching training program, and that's nationally accredited. So that's done by HCANSA, which is the Health Coaches Australia and New Zealand, and they're peak body within Australia for health coaching. So it's quite a lengthy process, and it's an accreditation, and really pride ourselves with our staff really having the certificate on top of their tertiary qualifications as well. But really, what does that mean? What does health coaching mean? So for us at Better Health Co, our coaching is really looking at being participant-led and client-centered. So when we talk about, client-centered practices or participant-led practice, it looks at the whole person. So you're really prioritizing a comprehensive consideration of the person when you deliver health support. So not just looking at the person in a silo, but recognizing there's a whole interconnected reasons and facets of health. So health can encompass physical things, mental, emotional, social well-being. So beyond, that initial presentation when someone comes to you, it's just really acknowledging the influence of social determinants on one's choices and why we make health decisions and why we make choices that we do. And what that sort of leads to is just providing a non-judgmental space for for individuals to discuss things like health, which can be sensitive and might be vulnerable, just in a safe environment. So I guess our team is highly qualified, but they also are trained up in the HECAN's health coaching program. And really that covers things like the practical application of things like motivational interviewing techniques and, like I mentioned, client-centered practices, but also covers principles such as trauma-informed care, which we are seeing a lot of people that do sign up for these services do tend to potentially have experienced trauma in the past. And so we need to understand that, provide support, and that's essential for all people, but especially when we're working with priority population groups as well. That's my little spiel on health coaching and why I think it's really important. Hopefully it's less fluffy after this presentation. So what's actually involved in our service itself? So really, I guess on a surface level, it's really 10 free coaching appointments for 30 minutes with a health coach, and that's completed over 6 months. So it's evidence-based and it's available for all adults in WA who are 18 plus, but they have to be looking for support to improve their healthy life choices, and also to either manage or prevent chronic conditions. So the service really centres around providing one-on-one or personalised support for people and really assist them in empowering them, I guess, to build motivation to actually reach whatever health goal they really set out. So the service itself adopts behaviour change techniques. Like I mentioned, motivational interviewing is a big one. And this is done to sort of empower adults to make informed decisions through things like practical education, goal setting, but also ongoing support. You have that same health coach for the whole 10 calls, and it provides them with that continuality of care. So really, once they are engaged in the service, each participant, like I mentioned, will receive 10 calls, and that's with a qualified health professional, and that can actually be used within a 6-month period. So they can really choose when they want to have that call. It can be weekly, it can be fortnightly, whatever option works for the individuals. We want to ensure there's readiness for change, and we want to really make sure that we're fitting into their schedules. So when we say that, we have health coaches all across WA and also in Victoria, but that just means our calls are available from 9 a.m. to 9 p.m. Australian Western Standard Time. So it's there all day to ensure flexibility. We have a whole range of participants that come through our service. Some might work 9 to 5, some might be retired. So it's just ensuring that we have flexibility for them too. Within that initial call, they've got their designated health coach discuss sort of their health history, build rapport, get to know each other, and then we sort of move into the assistance of developing personalised goals. So, you know, when they talk to the individual, understanding what they want to get out of the service, and then creating a plan essentially. And then following that, participants will have about 9 follow-up consultations. Again, an individual doesn't have to use all 10 calls. They do mostly, but they don't have to, but they will have up to 9. And during these calls, essentially the coach is there to action plan, set goals, problem solve. If things don't, you know, they set a goal for 1 week and they don't make it within the next week, there's no sort of shame or judgment or blame. But really they look at, okay, that wasn't achieved, what can we do moving forward, and just adjust really. But it's really there to encourage the development of new skills. And then within their last call, whether that be the 10th call or if they don't want to complete the whole 10, the coach will spend some time reflecting on their health changes, so looking at what's been made, but also plan for the future, so set goals and provide advice on further support options. And we're really emphasising, you know, working with other service providers in the community to provide them with additional support that potentially might be outside of scope, or support that is within the community face-to-face as well. So really, big sort of supporters on ensuring individuals feel connected to different supports within the community, because we find, you know, time and time again, there's a lot out there, but there's, I guess, difficulty with trying to communicate that there's a lot out there people don't know. So we are really sort of strong. There's a big emphasis now for the health coaches to refer or just provide further supports to the amazing resources that we do have within the community as well. And then I guess in addition to the calls, we also do have a moderated Facebook group. We have a lot of love for the moderated Facebook group. So people really do use it as, I guess, an environment to mimic social connection. So it's just an opportunity for other people to discuss their health journey with other individuals that might be going through the same thing. So there's an opportunity to post recipes or post foods that they've cooked, or, you know, new things that they've achieved, or new information that they've learned, but really just to support social connectedness within the community in a sort of virtual online forum. And then lastly, I guess, in addition to the calls and the Facebook group, we also do provide health literacy resources for all clients. So this is physical, and also we have online resources. They're developed by our amazing sort of health professional content development team, and they're designed to be sort of a support at home, so to sustain behaviour change at home. And there's a whole range of different things. So we have online fact sheets, online recipes. I'll show you some examples actually in the next few slides. But we also do have physical resources as well. So we have a magnet, a health journal, things like that as well that they do receive. Definitely stop me at any point as well if there's any questions, but if not, I might move to the core areas of support and ways that the health coaches can actually support the communities that you do work with. I always also, I guess, like to preface when we get to this stage that the health coaches are there to provide lifestyle and healthy lifestyle support to complement healthcare. So they won't ever sort of diagnose health conditions or offer medical advice or create treatment plans. We really do ask, if you do refer an individual and you are a health professional, that you do sort of preface this when you might mention the service to individuals. So really they're there to implement the guidance that they might receive from a health professional into practice through behaviour change. So with that said, kind of the core areas of support that coaches can support clients with are things like healthy eating, but it can be a bit more specific. So, it could be smoking cessation, cutting down on alcohol, building social connections, getting active, mindfulness. So actually seeing a lot of people actually come through for mental health support as well. So loneliness and stress reduction have been a big one. But really there's a whole range of different core areas of support, and it's at the discretion of the individual. What does the individual want to work on? Again, any advice that's provided by the health coaches will align to all national guidelines, the Australian Dietary Guidelines and the 24-hour movement guidelines. And we also stay up to date with all best sort of relevant evidence. So it's all evidence-based as well. The next slide here are the supporting resources that I raved on about. But like I've mentioned, we have a whole range that we provide as part of the service. So each participant will have access to a wide selection of these resources, electronic and a combination of physical as well. So they're all health literacy resources. And they actually are provided in a resource pack. So there's a whole range of wellbeing and health products, and they've been designed by health professionals. So that will include things like label reading supports. This is a great example of a hunger scale, and if you've been to one of my presentations, you'll know that I also use this in my house because I think it's quite handy. It's essentially a magnet, and you stick it on your fridge, and it really supports with mindful eating and just understanding mindful eating, which can be a bit of a complex and difficult to understand concept. And we just put, I guess, tricky, complex health information into really easy, manageable ways to understand. Similar in terms of different resources that we have, we also have specific fact sheets. So for example, this one's about lowering the GI of foods. We also have a really popular one at the moment is looking at food insecurity. So it's how to eat on a budget and ways to sort of strategies on how to eat when potentially money might be tight. And with those as well, we really want to ensure that our resources are appropriate and actually align with the needs of people. And some examples of sort of feedback that we've implemented is looking at our CAL community participants and understanding that, some of our foods that we have as example food items need to be culturally diverse. So they need to match the needs of individuals. So we've taken that on board and also looking at sort of providing tailored fact sheets. For example, healthy eating on Ramadan was a big one that we provided as well that just passed. Just making sure that our resources actually align to a range of communities and don't just sort of look at just a, I guess, Western standpoint, but a whole range of different communities as well. Moving on, so eligibility. We're quite lucky in terms of eligibility with this service compared to other services. It's actually quite open. So the Department of Health has allowed this sort of service to be free for any Western Australian adult who's either aged 18 plus, so there's no cap on age either. They have to be living in WA, and they also have to be seeking healthy lifestyle support to prevent or to manage a newly diagnosed health condition. So those are 3 eligibility criteria. So if you do work with individuals within the community that do align to this criteria, meet this criteria, they'll be more than welcome to be referred, or they can also self-register as well. Furthermore, in terms of chronic condition support, so like I mentioned, service is designed to complement and be integrated into a healthcare plan. But in saying that, the service is also suitable for people with a range of chronic conditions. So it can be, example, I guess, type 2 diabetes or pre-diabetes, mental health conditions as well, cancer rehabilitation, those who potentially have had stroke or nerve issues within their health as well. They're all eligible for the service. And we say this because it is there to complement healthcare. So it will aim to support participants to put health information into practice and empower them to achieve their health goals. So whether that be to increase levels of physical activity, increase the consumption of a healthier diet, reduce alcohol consumption, whatever it may be, it's there to sort of act as behaviour change and motivation, not supersede medical advice. So complement the health information that they receive by their treating professional and put complex information into practice. Moving on, in terms of outcomes as well, we have some high-level outcomes we can share. We don't have anything specific just yet that we can share, but it's something that we're definitely working on. And once we have that data, I'd love to share that externally as well. But just high level, we have seen participants achieve consistent sort of health behaviour change since starting the program. So we have seen increases in physical activity levels, increases in consumption of a healthier diet, reductions in alcohol consumption and smoking, which is great. But a big one that we have seen is actually improved social and emotional wellbeing, which potentially is something that we're really, not that we didn't expect, but potentially something that was more unexpected than the others. It's really nice to see. And I think in the next few slides, I actually have some testimonials from some individuals, and I think it's really testament to this outcome metric. And I'd love to share that with you too. It's always nice to see that it's helped within that area too. So why refer? Why is this important, and why should you refer the patients that you work with or the community members that you do work with? And like I've said a lot, it's really an opportunity, a free opportunity to put health literacy into practice and empower communities to make better choices. So we really support complementing client care. It's a big sort of phrase that I like to use, but really to bridge the gap between advice and action and what that means. So I work in public health, and I really believe in empowering individuals to have the best possible outcomes. So really the service, I think, aligns with that. It's personalised support, it's tailored health coaching for key pillars such as nutrition, physical activity, and behaviour change and overall wellbeing. But also there's no wait list. So you have immediate access, it's free support, you've got frequent touch points, you've got a coach that really cares, that's there with them for the whole 10 calls, and offering that expert guidance with a health coach without a cost as well. And also can help patients, say for example, you might be a treating health professional, implement treatment plans. Health can be complex, so it's nice to have someone that you can lean on as support to manage chronic conditions, or just to sort of improve general wellbeing too. But really, it's there to empower adults to improve and maintain health and wellbeing. We're nearly approaching the end of the session today, but I just want to illustrate really clearly what it might look like if you do refer an individual into the service. So once you do refer a participant to the service, we have an intake registration team, and they're in-house. So essentially they'll contact each person directly, and that's done by a phone. Our best practice is the next day. Sometimes it might be 2 days. And we also really aim to sort of have 2 days as the longest, but potentially can be a bit longer in busy period. But really that's an opportunity to firstly confirm all the details and eligibility, but also to go through a bit of a medical screening. So just understand their goals, understand their health history just before they actually meet their coach, and also understand what they're aiming to get out of the service as well. Once eligibility is confirmed and the individual selected their times, they're allocated a coach, coaching calls begin, and then service delivery is really underway. So they have their 10 calls, and then once they complete that service as well, if you are a referring health professional, you are contacted with an outcome report for each individual that you do refer on. You're also kept up to date, at the beginning. So if you refer someone, we let you know that received the referral. If that individual has declined, we also provide you a letter with that reasoning as to why they have declined, and if they've, approved or accepted the referral, we'll also let you know too. That's, I guess, a key benefit of direct referrals rather than sort of a self-referral. It's just that you get that constant update. So you'll see how they're doing, how they're progressing throughout the service. When an individual self-refers, it's still great, but they do have to nominate you to share any health information with you and provide confirmation to share any sort of progress with the health professional as well. So we do have to ensure that we have that consent. But essentially, with service delivery underway, we're really, really keen to get as many WA adults through the service as we can. So if you do work with people, that might benefit from the service, we'd love to, have shared resources. I can send out some resources, information, anything really that you need from me. I'm your point of call, and so is my colleague Emily as well. But don't hesitate to get into touch. And that leads us to so a few ways. We're trying to make it as simple as we can for you. But if you want to do a direct referral, you can call, you can download our PDF, and I can send that through and fax that through as well. We have an online referral form, which is our preferred way, but again, it's up to you what works. But essentially, it's just on our website. There's a refer now button, fill in your details, fill in their details, and that goes straight into our CRM, and it's all secure and confidential. Again, like I mentioned, we don't discriminate. So if people want to self-refer, or you have a flyer and you might give it to an individual that you see and they might want to think about it as well, they can self-refer and sign up themselves online or call us. And we also have Facebook advertising too, so they can self-register through our Facebook ads as well. But that kind of takes us to the end of the presentation. I do have a testimonial, one's a video, and then I have some written feedback from some participants on our service. I always think it's really important. I can rave on about the service as much as I want, but I think it's important to hear from the people that have actually experienced it firsthand. If we did have time, I might share that. Let me see if this is working. Please stop me if you can't hear, but I think that should be okay. That's one of our client testimonials. I actually spoke to her firsthand. I thought it was really lovely to add because I think it's relevant, talking about health can be daunting sometimes. I had a client once mention to me that, she was 60 years old and she just felt embarrassed because she thought she should know these things. And, no one should ever be embarrassed about health, but I think it's really important that we understand the different sort of factors that do impact people's choices and what life stage they're at as well, and to create an environment where they can freely talk about it and support it too. Guys, we're back. Following on, a little bit more feedback. This is some written testimonials too. So we have people provide videos, but they can also provide written feedback. And the one on the right, I think, is really, really stood out to me. But this client is 38, and they had mentioned that this was such a positive service for them. So they found amazing follow-up. I could tell that there was a health professional on the other side of the phone, and I was surprised that something like this was available and followed through right until the end of 6 months. It was invaluable. I think that goes hand in hand with just understanding how much support there might actually be out there in the community. And hopefully I do my job well and more people will be aware of our service. But yeah, quite nice to see that she found it quite positive as well. But that takes us to the end of today's session from me. Thank you so much for your time. I did chat for, a whole 30 minutes, but there's an opportunity for questions. So if anyone did have any questions for me, I'd be happy to answer them to the best of my ability.
Hi, Leila.
Hey, Deb, Jana. Hey.
Thank you for your presentation. I have Yana, a nutrition and environmental health student with me, environmental management, student with me at the moment. I was just curious about, I had a brief conversation with somebody who'd used the service for her child and was potentially interested in using it for herself, but she just had a query around whether or not there's a difference in the coaches between adults and paediatrics, or if you kind of, I got the sense that maybe she just didn't gel with the coach, and whether there was the opportunity for her to have maybe said, could she, have another coach as well? Yeah,
100%. I think it's really important to acknowledge, sometimes some coaches might have a approach that works better for other people, and vice versa. So yes, she definitely can request someone else. And the intake team do a really good job in understanding their health goals, and say if something's a bit more complex, they will sort of match up a coach that potentially has a background in a specific area as well. So there's always leeway to match coaches where there's capacity to an individual's needs. So yes, if she, potentially didn't gel well with a coach in the past for her child, she's more than welcome to request someone else, of course, understandable.
Thank you. And I'm not sure if it was the particular coach as well, but she just indicated, I saw that, that's great, that 12-hour time window, but she mentioned before I'd seen that, she thought because the coach was from interstate, that affected her ability to get a time slot she liked. I don't know, again, it was perhaps she could have just asked for somebody in WA. Okay, I'll just feed that back to her. Thank you. And look to, when you get that evaluation data so that we can use it in conjunction with our in-person programs in the Southwest. Thank you.
No, of course. No, great question. Thanks for feedback too. Thank you.
I had a question, Leila, just while we're waiting for others. You mentioned eligible adults and that it was people with newly diagnosed conditions. What's the newly, like how soon is newly?
Great question. So because we're in the early phases of the service, it wouldn't turn anyone away. So if potentially they might, newly we would, characterize as within 12 months. But because it's a new service and we're hoping to reach as many people as we can take people on by a case basis. So if someone does have a chronic condition that might be a bit long-standing, has been diagnosed a while ago, we wouldn't turn them away. So case by case, we're allowed to sort of see if there's leeway there. But in terms of how to characterize newly, we would say 12 months.
Awesome, thank you. And I did just have another question around, are people, you mentioned that people are allocated a health professional, and you may have answered it a little bit in your last answer, but is that done randomly, or is there a particular, are you sort of looking for something during the intake that might mean you see a exercise physiologist or a psychologist?
Yeah, that's a really good point. Yes, exactly that. So where capacity, where we're able, I guess, if an individual, say, for example, has a complex case or they're looking at a certain area as well, it's something, all our majority of our health coaches are dietitians, and a lot of individuals do seek dietetic support. But if the support might be a little bit different, we can definitely, to the best of our ability, match or allocate a coach that meets the needs of the individual. And saying that too, if the coach isn't the right fit, they can always change coaches as well. They don't have to stay with the same coach for the whole 10 calls. We want to make sure that they're getting the most out of the service. So, of course, if the approach that one coach works for someone but potentially doesn't work for someone else, they have the ability to move coaches as well, of course.
Awesome. Thank you.
That's right. Good questions.
Thank you.
So anyone else?
Did anyone else? Yeah.
Take that as a good thing. Did talk for half an hour.
It's very thorough, which is great.
Yeah. But if not, thank you so much for the opportunity to present today. All my details are on the screen as well. So if you did want further information, we have a heap of promotional resources. So if you did need digital or physical flyers or any resources for any of our services, feel free to email me. You can contact us on our generic line as well. But yeah, my job is to be a point of contact for the community. So reach out if you have any questions at all or need anything.
Leila, sorry, I just have one question. I couldn't find the mute button.
It's okay.
I run a chronic disease funded service up in the Pilbara, and we're sort of reaching capacity and we have quite strict eligibility criteria for our services around diabetes and weight management. Just wondering how strict your eligibility criteria is in terms of, do you have a BMI minimum, or do you need pathology along with the referral, or is your eligibility a little bit more broad?
Yeah, great question. We're really lucky. So with this service, it's very broad. So no BMI eligibility. They literally just have to be living in WA, 18 plus, and like the last sort of slide, just have been either newly diagnosed or at risk of a chronic condition. So yeah, no need for pathology results. Will be my eligibility either. This service particularly is quite broad with the eligibility, so quite lucky.
Awesome. Thank you very much.
That's all right. Great question. I think that might be it. But again, any questions, feel free to email through as well. I can answer the best of my ability by email too.
Awesome. And Tanya, you're going to upload this to the recording of the webinar?
Yes, I am. So I will edit it and upload it, but it probably won't be for a week or so. So yeah, but I will do.
Awesome.
Yep. To the lovely new YouTube channel that I need to tell people about.
5 minutes of fame.
Yep.
Thanks so much, guys. It's really great. It's an engaging cohort, and I hope you got something out of the presentation too.
It was fantastic. Thank you so much for your time.
Thanks, everyone. Have a great day. Enjoy the rest of your day.
Thank you.
Thanks, Leila.
Thanks, Leila. Thanks, Emily.